Hello and welcome to Nurse's Handbook. Today we will be continuing with the types of insulin. In the previous video, we have discussed about the background of insulin, parameters on which insulin is categorized, and have discussed about the two types, that is rapid acting and short acting insulins. Now let me tell you about the third type, that is the intermediate acting insulin. These are absorbed slowly but lasts longer. It is used to control blood sugar overnight while fasting, and that is why it comes under the category of basal insulins. It is given along with rapid or short acting insulin for mealtime control of the blood glucose. Examples are insulin NPH, that is neutral protamine hagidone. Another name for this preparation is isophene. The second example is insulin lente. These insulins are given only subcutaneously, never intravenously, and should never be used when rapid glucose lowering is needed, like in case of diabetic ketoacidosis. It begins its action within 1 to 2 hours and have its peak effect at 4 to 6 hours, and the duration of action extends up to 12 hours. Action profile depends upon dose. That is, if small doses administered, peak effect will be early and duration of action will be shorter. Whereas if high doses given, peak effect will be longer and duration of action will be prolonged. A very important point to remember is there is always a risk of nocturnal hypoglycemia if administered at bedtime, as peak effect is 4 to 6 hours. And it has a cloudy appearance, so it is easy to identify and differentiate it from the short acting and the rapid acting insulins. Nowadays we have premixed preparations, which is a combination of intermediate acting insulin plus rapid or short acting insulins. Some examples which we are having is Novolog 70-30, Humalog 75-25, Novolin, which is also known as Mixtard 70-30, etc. are some of the examples. The advantage of using the premixed insulin are: first is lesser injections can be given to the patient. Secondly, it contains both the components for mealtime and fasting control. Now let us see the disadvantages. It is a strict meal pattern needs to be followed, nocturnal hypoglycemia and weight gain may occur. And third is there may be a need to change the diet according to the insulin dose rather than an insulin change for the diet. The last type of insulin is the long-acting insulins. They are absorbed very slowly and have a very minimal peak effect, used to control blood sugar values overnight while fasting. Examples of long-acting insulin analogues are insulin glargine and insulin detimar. This begins its action in 1.5 to 2 hours, and the duration of action lasts for 12 to 24 hours for insulin detimar and 24 hours for insulin glargine. And that is why in some places glargine comes under the category of very long-acting insulins. An important point to remember that this long-acting insulins has got decreased risk of nocturnal hypoglycemia. Now let us see some of the nursing considerations or responsibilities while handling insulins. Firstly, avoid vigorous shaking. Instead, gently roll them before using. Second is to rotate the subcutaneous injection sites to reduce lipodystrophy. Next is that in cases of severe ketoacidosis or diabetic coma, regular insulin to be given intravenously or intramuscularly. Fourth responsibility is to obtain a baseline PFT reports of the patient if they are using inhaled insulins. Fifth responsibility is never give concentrated insulins directly into the veins, as severe anaphylactic reactions may occur. Next is always draw rapid or short acting insulins first, then intermediate acting insulins while mixing. That is, draw up the clear before the cloudy. Next is prepared mixtures to be used within 5 to 15 minutes of combining them. Always remember that rapid acting insulins must be given right before the meals only. Next is carefully monitor the patient being switched from one type of insulin to another for blood glucose levels. Insulin needs to be stored in refrigerator, but remember it should not be freezed. The opening date and time of vials should also be mentioned over the vial. Ensure the availability of life support equipment and glucose to deal with ketoacidosis and hypoglycemic reactions. Monitor urine or blood levels for glucose and ketones. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.